Hello, I am Dr. Ahilasamy from Chennai. I am going to show a interesting case of inverted papilloma left nasal cavity endoscopic excision under local anesthesia. This is a 79-year-old male patient presented with nasal block. You can see the coronal CT scan image. It's a bone window showing mass in the nasal cavity on the left side, and the left maxillary sinus is also opaque. Septum is slightly deviated, and soft tissue cuts doesn't show heterogeneity like a fungal element, but homogeneity. This is a diagnostic endoscopy. Septal deviation anteriorly is there. This is a right nasal cavity. So the whole nasal cavity is filled with the polypoidal like a papilloma like mass filling the right nasal cavity in diagnostic endoscopy. So I took the case under local anesthesia. As usual, the first step is packing the nasal cavity with a roller gauze soaked in 4% lignocaine and adrenaline in the ratio of 1:1 repeatedly. Please watch these videos on bigger screen or laptop or TV monitors. Do not watch on mobiles. Then only you will appreciate the quality. After decongestion, the mass has been shrunk not much, but you can see the polypoidal mass. I don't know the attachment. Of course, if you are taken a CT scan, then you would have know the attachment. Now I am giving the anterior ethmoidal block on the left side. Now I am giving this spinopalatin block. Accessory ostia of the maxillary sinus is open. So for biopsy, I am taking maximum part of the specimen, thinking that it could be an inverted papilloma for histopathology. So gently taking it out. The mass is filling the middle meatus and anterior to the middle turbinate, and it is occluding the middle meatus. So there was lot of collection within the mucus collection in the maxillary sinus. Gently pulling it out with the Blackesley forceps. Remember, it is a 79-year-old male patient. Surgery being done under local anesthesia with moderate IV sedation with dexmedetomidine and fentanyl. That's a mass. Papillomatous looking like polypoidal mass. Later, the histopathology came out as a inverted papilloma. Of course, we didn't do any preoperative biopsy. So a big chunk has been already removed. So another piece of that papillomatous mass is being taken out. Patient is very cooperative under local anesthesia. Now the middle meatus has cleared and the anterior also has cleared. You can see a lot of secretions which has been from the maxillary sinus mucus, thick mucus secretions because of the obstruction by the papillomatous tissue has been sucked out. The bulla is being thinned out, middle terminal is thinned out, and I know this papilloma is attached to the lower part of the middle terminal, so I am resecting the lower half of the middle terminal with a margin of around 5 to 6 millimeters. Quite a good margin I have given. I hardly used a shaver system in this case. There's a posterior attachment of the middle turbinate. Appreciate the field quality, hardly any bleeding. Now, the remaining mass which had been attached to the middle terminate is resected with a clear margin of the middle terminate for around 5 to 6 millimeters. So you can't expect any recurrence from this mass. Even though we didn't do a pre-op biopsy or a MRI scan, still by the appearance and everything, I thought it could be an innovative papilloma and did. The accessory ostia of the maxillary sinus through which the pent-up secretions are being sucked out. There is no pathology within the maxillary sinus, so I didn't do any middle metal antrostomy unnecessarily, which is not needed. More secretions are being sucked out, which had been in the sinuses because of the blockage by the mass in the middle meatus. Very thick mucus secretions. All the secretions are being sucked out. Now have a good look at the middle meatus and the maxillary sinus with a 70-degree telescope, and more secretions are being sucked out. It's a very wide, that's a natural ostia, and the accessory ostia you can see quite wide enough, so I don't want to wide since there is no pathology. With a 70-degree telescope, that's the view. Now I come to the 0-degree, hardly any bleeding. So we don't routinely pack the nasal cavity after any FES or septal surgery or turbinate surgery or even for tumors. So hardly any bleeding. Appreciate the field quality under local anesthesia. And the patient will be discharged on the same day as daycare procedure. Keep watching my videos on bigger screens, and see you in another beautiful video soon. Thank you for watching. Bye bye. You can contact me in my email ID and everything anytime.